Vitamin D3 is one of the most overlooked yet powerful nutrients the body needs, and it goes far beyond the common association with just bone health. Most people think of it as a simple vitamin, but in reality, vitamin D functions more like a hormone. No. Hormones are chemical messengers that regulate countless processes in the body, and without adequate levels of vitamin D, the body cannot operate at its highest potential. This nutrient is essential for immune strength, calcium absorption, mood regulation, energy levels, and even the prevention of chronic diseases. Unfortunately, the majority of the population is deficient in vitamin D, largely because modern lifestyles keep people indoors, away from natural sunlight, which is the primary source of vitamin D synthesis. When your skin is exposed to UVB rays from the sun, it converts cholesterol into vitamin D3, which then goes through processes in the liver and kidneys to become its active form, calciferol. This active form binds to receptors in nearly every cell of the body, which shows how critical it is. It influences genetic expression and impacts hundreds of different functions. If vitamin D levels are low, the immune system weakens significantly. That is why people with vitamin D deficiency are more prone to frequent colds, flu, and infections. The immune system relies on vitamin D to activate T cells, which are the soldiers of your defense mechanism. Without enough vitamin D, these cells remain dormant, unable to properly fight off invaders. Beyond immunity, vitamin D has a major role in calcium absorption and bone health. Without it, your body cannot absorb calcium efficiently from food, no matter how much dairy or supplements you consume. This leads to weak bones, brittle nails, and in severe cases, conditions like rickets or osteoporosis. But it doesn't stop there. If calcium is not directed properly, it can deposit in the wrong places such as arteries, joints, or soft tissues, leading to calcification and stiffness. This is why pairing vitamin D3 with vitamin K2 is crucial. Vitamin K2 activates proteins that shuttle calcium into the bones and teeth, preventing it from causing harm in other areas of the body. Many people make the mistake of taking vitamin D3 without K2, which can create an imbalance over time. The synergy between the two is what makes the supplementation truly effective and safe. Another important aspect of vitamin D is its effect on mood and mental health. Low levels are strongly linked with depression, anxiety, and seasonal affective disorder, especially in regions with limited sunlight during the winter months. This is because vitamin D receptors are present in areas of the brain responsible for mood regulation. By supporting neurotransmitter balance, vitamin D contributes to feelings of well-being and mental clarity. People who correct a deficiency often notice a significant lift in their mood, better focus, and more stable emotions. Vitamin D is also essential for energy metabolism. Many people complain of constant fatigue and low energy, and while they may try stimulants like caffeine, the root cause is often a deficiency in this nutrient. Vitamin D influences how the mitochondria, the powerhouses of the cell, produce energy. Without it, your body simply cannot generate energy efficiently. This is why fatigue is one of the earliest signs of deficiency. Correcting vitamin D levels can dramatically improve vitality, exercise performance, and recovery. In addition to energy and immunity, vitamin D plays a major role in reducing inflammation. Chronic inflammation is the underlying factor in most degenerative diseases, including diabetes, heart disease, and autoimmune conditions. Vitamin D modulates the immune response, keeping it balanced so it does not overreact or underreact. This helps reduce unnecessary inflammation and protects tissues from long-term damage. Research shows that people with higher vitamin D levels have a lower risk of chronic disease, which makes maintaining optimal levels a key factor in long-term health. The problem, however, is that dietary sources of vitamin D are extremely limited. Fatty fish, cod liver oil, and egg yolks contain some, but the amounts are usually not enough to meet the body's needs. Sunlight is the best source, but modern indoor lifestyles, sunscreen, and living in northern latitudes make it hard to rely on sunlight alone. This is why supplementation becomes so important. The recommended daily amount for many people is far too low compared to what the body actually requires. Studies suggest that blood levels between 50 and 70 ng/ml are ideal for optimal health, which usually requires supplementation of several thousand per day. depending on body weight, skin tone, and sun exposure. It is also worth noting that vitamin D is fat soluble, which means it should be taken with fat-containing meals for better absorption. Pairing it with healthy fats like avocado, olive oil, or nuts enhances its effectiveness. At the same time, getting adequate magnesium is important because magnesium is needed to convert vitamin D into its active form. Without magnesium, supplementation may not work as effectively, which is why a holistic approach is best. Magnesium is one of the most underestimated minerals, yet it is absolutely critical for maintaining overall health and well-being. It is involved in more than 300 biochemical reactions in the body, which means it plays a part in nearly every function you can imagine. From energy production to muscle relaxation, nerve signaling, blood sugar balance, and even heart rhythm, magnesium is at the center of it all. Despite its importance, most people today are deficient in magnesium without realizing it, and this deficiency contributes to a wide range of health problems that are often misdiagnosed or misunderstood. One of magnesium's most important roles is in energy production. Inside each cell are mitochondria, which act like power plants, producing energy in the form of ATP. Magnesium is required for ATP to be biologically active. In other words, without magnesium, the energy your body produces cannot even be used properly. This is why low magnesium often shows up as fatigue, muscle weakness, and a general sense of exhaustion. People sometimes assume they are tired because of lack of sleep or stress, but the deeper cause may simply be that their cells cannot use energy efficiently due to magnesium deficiency. Another crucial role of magnesium is in muscle and nerve function. Muscles contract when calcium enters the cells, but they need magnesium to relax again. Without enough magnesium, muscles stay tight, leading to cramps, spasms, tension, or twitching. This is one of the most common symptoms of deficiency. Magnesium also helps regulate nerve signals, allowing communication between the brain and the rest of the body to remain smooth and balanced. A deficiency can lead to irritability, restlessness, anxiety, and even sleep disturbances because the nervous system is overstimulated without magnesium's calming effect. Sleep quality is another area where magnesium shines. It supports the production of neurotransmitters such as GABA, which promotes relaxation and deeper sleep. Many people suffer from insomnia or poor sleep quality, trying different solutions without realizing magnesium is the missing piece. Supplementing with the right type of magnesium, especially before bedtime, often results in more restful, uninterrupted sleep and improved recovery. Magnesium also plays a big role in blood sugar regulation. It helps insulin transport glucose into the cells where it can be used for energy. If magnesium levels are low, insulin cannot function as effectively, which leads to higher blood sugar levels. Over time, this contributes to insulin resistance and increases the risk of type 2 diabetes. In fact, studies show that people with adequate magnesium intake have a much lower risk of developing diabetes compared to those who are deficient. This connection explains why magnesium-rich diets can stabilize energy levels and reduce cravings, especially for sugar and refined carbohydrates. So the cardiovascular system depends heavily on magnesium as well. It helps regulate blood pressure by relaxing blood vessels and preventing them from constricting too much. It also supports a healthy heartbeat by balancing calcium and potassium levels inside the heart muscle. Without enough magnesium, the risk of arrhythmias, hypertension, even heart attacks increases significantly. This is why magnesium is sometimes referred to as nature's natural calcium channel blocker, working in a similar way to some blood pressure medications, but without the side effects. Stress is another factor that drains magnesium from the body. When you are under chronic stress, your adrenal glands release more cortisol and adrenaline, which in turn increases the demand for magnesium. But at the same time, a deficiency in magnesium makes it harder to handle stress, creating a vicious cycle where stress depletes magnesium, and low magnesium makes stress feel overwhelming. This is one reason why modern lifestyles, full of pressure, caffeine, and poor diets, leave so many people depleted. The problem is made worse by the fact that our food supply no longer provides enough magnesium. Decades of industrial farming have depleted the soils, which means vegetables and grains contain far less magnesium than they used to. Processed foods strip away even more, leaving very little behind. Add to that high consumption of sugar, alcohol, and caffeine, all of which deplete magnesium even further, and it is easy to see why deficiency is so widespread. When it comes to supplementation, not all forms of magnesium are equal. Magnesium oxide, which is one of the cheapest and most common forms, is poorly absorbed and often just works as a laxative. More effective forms include magnesium glycinate, magnesium citrate, and magnesium malate, which are much better absorbed and have specific benefits. Magnesium glycinate is calming and good for sleep. Citrate can help with digestion, and malate is supportive for energy and muscle performance. Choosing the right form can make a big difference depending on your specific needs. Because magnesium works in harmony with other nutrients, it should not be considered in isolation. Adequate vitamin D, B vitamins, and potassium all interact with magnesium to support energy, muscle, and nerve function. When one of these nutrients is missing, the others cannot work properly. This is why many people find that balancing magnesium along with other electrolytes provides the most noticeable results. Omega-3 fatty acids are among the most important nutrients for maintaining long-term health, yet they are often overlooked in modern diets. These essential fats, especially EPA and DHA, play a fundamental role in the structure and function of every cell in the body. They are called essential because the body cannot produce them on its own, which means they must be obtained through diet or supplementation. Unfortunately, the average person consumes far too few omega-3s while getting an excess of omega-6 fats from vegetable oils, processed foods, and fried snacks. This imbalance creates widespread inflammation, which becomes the foundation for many chronic health conditions. Correcting this imbalance by increasing omega-3 intake is one of the most powerful steps someone can take to improve their health. One of the greatest benefits of omega-3s is their ability to lower inflammation. Inflammation is not always a bad thing. It is a natural process that helps the body heal from injury and fight infection. Algae oil is especially useful for vegetarians and vegans as it provides DHA directly from the same source that fish get it from. When choosing supplements, it is important to select high-quality options that are purified to remove toxins like mercury and heavy metals. Freshness also matters since omega-3 oils can oxidize easily and lose their effectiveness if they are rancid. Dosage can vary depending on individual needs, but most people benefit from around 1,000 to 3,000 milligrams of combined EPA and DHA per day. Higher doses may be recommended for specific conditions like high triglycerides or inflammatory disorders, but it is always important to ensure the supplement is taken consistently with meals that contain fat for better absorption. Zinc is a trace mineral, which means the body only needs small amounts, yet its impact on health is profound. It is required for the function of more than 300 enzymes and influences virtually every system in the body. From supporting immunity to maintaining healthy skin, hair, and reproductive function, zinc plays an indispensable role. Unlike some nutrients that the body can store for long periods, zinc must be supplied regularly through diet or supplementation, and deficiencies are far more common than most people realize. Modern farming practices, processed foods, and even stress contribute to lower zinc levels, leaving many people vulnerable to the effects of deficiency without being aware of it. One of the most important roles of zinc is in immune function. It is directly involved in the production and activation of white blood cells that defend the body against bacteria, viruses, and other pathogens. Without enough zinc, these immune cells cannot function properly, making the body more susceptible to frequent colds, infections, and slower recovery times. Zinc also acts as an antioxidant, helping to stabilize cell membranes and reduce oxidative stress, which further supports a stronger defense system. People who supplement with zinc during the onset of a cold often notice shorter duration and reduced severity of symptoms, which demonstrates its direct connection to immunity. Zinc is equally important for skin health. The skin is one of the body's first lines of defense against the outside environment, and zinc is critical for wound healing, cell repair, and controlling oil production. Deficiencies often show up as acne, rashes, eczema, or slow-healing cuts and bruises. This is because zinc regulates inflammation in the skin and ensures proper turnover of skin cells. It also helps maintain collagen structure, which supports firmness and elasticity. Without enough zinc, the skin becomes more prone to irritation and scarring. This is why topical creams often contain zinc oxide to calm inflammation and protect the skin barrier. Hair and nail health are also linked to zinc. Since zinc influences protein synthesis, it directly affects the growth and strength of hair and nails. Low zinc levels often result in thinning hair, brittle nails, or even hair loss. Many people seek complicated solutions for hair problems, but correcting a zinc deficiency is sometimes enough to restore healthier growth. The connection between zinc and keratin, the main protein in hair and nails, highlights just how central this mineral is to outward signs of vitality. Reproductive health is another area where zinc plays a significant role. In men, it is crucial for testosterone production and sperm quality. Low zinc can contribute to reduced fertility, lower energy, and even hormonal imbalances. In women, zinc supports ovarian function, egg quality, and menstrual cycle regulation. Because of its involvement in hormone synthesis and balance, zinc is often considered essential for both male and female reproductive health. Pregnant women in particular require adequate zinc to support the growth and development of the baby, as deficiency during pregnancy can lead to complications and developmental issues. Zinc also affects taste and smell. Many people who are deficient report a reduced sense of taste, making food seem bland, or a diminished sense of smell. This is because zinc is required for the enzymes that support these sensory functions. Restoring zinc levels can often reverse these changes, which shows how closely this mineral interacts with daily quality of life. The challenge with zinc is that it must be balanced with copper. Both minerals compete for absorption in the body, and taking high amounts of zinc over time can cause copper deficiency, leading to anemia, fatigue, and weakened connective tissues. This is why balance is key. Many supplements pair zinc with a small amount of copper to prevent this problem. Typically, a ratio of around 10:1, 1 or 15, 1 zinc to copper is considered safe and effective. Dietary sources of zinc include shellfish, particularly oysters, which contain the highest concentration of any food. Red meat, poultry, nuts, seeds, and legumes also provide zinc, though the plant-based sources are less bioavailable because of compounds like phytates that block absorption. This means vegetarians and vegans are at greater risk of deficiency unless they carefully plan their intake or use supplementation. Cooking and soaking legumes can improve absorption, but supplementation is often the most reliable method for reaching adequate levels. Signs of zinc deficiency go beyond the obvious immune problems or skin issues. They can include poor appetite, stunted growth in children, frequent illness, delayed wound healing, brain fog, and irritability. Since zinc is required for neurotransmitter activity in brain health, deficiencies can even contribute to mood disorders and difficulties with concentration. The widespread impact of this mineral makes it one of the most important trace elements to monitor and support. Supplementation with zinc can be very effective, but the type of zinc used matters. Zinc picolinate, zinc citrate, and zinc gluconate are among the better absorbed forms. Doses between 15 to 30 milligrams per day are usually sufficient for most adults, though higher therapeutic amounts may be recommended for short periods in cases of deficiency. Consistency is important, since the body cannot store large reserves. B vitamins are a group of water-soluble nutrients that play an essential role in the body's energy production, brain health, and stress management. They are often referred to as the energy vitamins because they convert food into fuel and support the nervous system at multiple levels. There are 8 different B vitamins, each with unique functions, but they work best together as a complex. Deficiency in even one of them can cause noticeable problems since they are so tightly interconnected. Modern diets, high stress levels, and processed foods have created widespread deficiencies, making B vitamins more important than ever for maintaining physical and mental performance. One of the most important B vitamins is B1, also known as thiamine. It is crucial for converting carbohydrates into usable energy and plays a key role in the nervous system. Without enough bone, the brain and nerves cannot function properly, which often shows up as fatigue, irritability, brain fog, and even nerve pain or tingling. Severe deficiency in thiamine leads to a condition called beriberi, but even mild deficiencies can cause issues with mood, concentration, and stress tolerance. Since sugar and refined carbs rapidly deplete thiamine, many people unknowingly create deficiencies through their daily diet. Correcting bone intake often leads to noticeable improvements in energy levels and mental clarity. B2 or riboflavin is another critical vitamin in this group. It acts as a cofactor for enzymes that produce energy and also supports antioxidant defenses by helping regenerate glutathione, the body's master antioxidant. Without riboflavin, cells struggle to manage oxidative stress, leading to faster aging and cellular damage. Low riboflavin levels often show up as cracks at the corners of the mouth, sore throat, or inflamed skin. Since it supports mitochondrial energy production, B2 is essential for people dealing with fatigue or metabolic issues. B3 or niacin is heavily involved in metabolic pathways. It helps create ET and ATCP, coenzymes necessary for energy transfer and DNA repair. Niacin has been studied for its ability to support cardiovascular health by lowering LDL cholesterol and raising HDL cholesterol. It also improves circulation and can help with skin health. However, high doses can cause flushing, which is a harmless but sometimes uncomfortable side effect. And adequate niacin levels support smoother energy flow and stronger resilience to stress. B5, or pantothenic acid, is best known for its role in producing coenzyme A, which is required for synthesizing hormones and neurotransmitters. FLU. This makes it particularly important for adrenal health and the stress response. People who are under chronic stress may deplete their B5 reserves more quickly, leading to adrenal fatigue, low energy, or hormone imbalances. Because it is involved in producing cortisol and other stress-related hormones, B5 helps the body adapt more effectively to physical and mental challenges. B6, or pyridoxine, is essential for amino acid metabolism and neurotransmitter production. It helps the body produce serotonin, dopamine, and GABA, which regulate mood, sleep, and stress responses. Deficiency in B6 often leads to irritability, depression, insomnia, or even nerve-related issues. It is also important for hemoglobin production, making it vital for oxygen transport in the blood. In women, B6 can help with symptoms of premenstrual syndrome because of its role in hormone regulation and neurotransmitter balance. Butter known as biotin is often associated with hair, skin, and nail health. It supports keratin production, which is the main structural protein in these tissues, but biotin also plays a role in fat and carbohydrate metabolism. People who consume raw egg whites regularly can develop a deficiency because they contain avidin, a compound that binds to biotin. Supplementing with biotin often improves brittle nails, hair thinning, and certain skin conditions. B9 or folate is essential for DNA synthesis, red blood cell production, and fetal development during pregnancy. Adequate folate intake prevents birth defects such as spina bifida and supports healthy cell division. It also works with B12 and methylation processes which affect detoxification, brain health, and cardiovascular function. Folate from food sources is ideal, but many people turn to supplements because absorption can be compromised. Folate should not be confused with folic acid, the synthetic form, which some individuals cannot process efficiently. B12, or cobalamin, is another crucial vitamin, especially for nerve health and energy. It is involved in the production of myelin, the protective coating around nerves, and supports the formation of red blood cells. Deficiency often leads to fatigue, numbness, tingling, memory problems, or even anemia. Since B12 is found primarily in animal products, vegetarians and vegans are at higher risk of deficiency and often need supplementation. It also works closely with folate to regulate homocysteine levels, which influence cardiovascular health. Because the B vitamins are water-soluble, the body does not store them in large amounts, and they must be consumed regularly. Stress, alcohol, caffeine, and refined foods all increase the body's demand for B vitamins, which is why deficiencies are so common. Nutritional yeast is one of the best natural sources, providing a broad spectrum of B vitamins, especially thiamine, in a highly bioavailable form. Many people notice increased energy, better stress tolerance, and improved mood when they add nutritional yeast or a B-complex supplement to their diet. Electrolytes are minerals that carry an electrical charge and play a fundamental role in nearly every process of the body. They regulate fluid balance, nerve signaling, muscle contractions, heart rhythm, and pH levels. The main electrolytes include sodium, potassium, magnesium, calcium, chloride, and phosphate. But among these, potassium, sodium, and magnesium are the most critical for day-to-day health. Without a proper balance of electrolytes, cells cannot function properly, which is why even mild imbalances can cause fatigue, weakness, confusion, and muscle problems. The body constantly loses electrolytes through sweat, urine, and even normal breathing, so they must be replenished daily, especially during times of stress, exercise, or illness. Potassium is perhaps the most important electrolyte, yet it is also the one most people are deficient in. The average adult requires about 4,700 milligrams of potassium per day, but most diets fall far short of this. Potassium is vital for maintaining normal blood pressure because it balances out the effects of sodium. When potassium is low and sodium is high, blood pressure rises, creating a risk for heart disease and stroke. Potassium also supports muscle contractions, nerve impulses, and hydration at the cellular level. Deficiency can lead to muscle cramps, weakness, irregular heartbeat, and even anxiety or irritability. Since potassium is abundant in vegetables, leafy greens, avocados, and certain fruits, a diet rich in whole plant foods is the best way to raise levels. However, most people consuming processed foods rarely reach their daily requirement, which is why electrolyte supplementation can be so helpful. Sodium is another essential electrolyte, often misunderstood because of its association with processed food and hypertension. While excessive sodium from refined salt and junk food can be harmful, sodium itself is crucial for nerve signaling, fluid balance, and stomach acid production. Without enough sodium, people may experience dizziness, brain fog, low energy, and low blood pressure. Athletes, or those on low-carb or ketogenic diets, often lose more sodium through urine and sweat, which can lead to dehydration-like symptoms even if water intake is adequate. In these cases, adding unrefined salt, such as sea salt or Himalayan salt, can restore balance and dramatically improve energy and focus. The key is balance. Too much processed sodium with too little potassium causes problems, but adequate amounts of both create stability in blood pressure and overall hydration. Magnesium, often called the relaxation mineral, is not only an electrolyte but also a cofactor in hundreds of enzymatic reactions. It helps muscles relax after contraction, prevents cramps, and supports proper nerve communication. A deficiency in magnesium contributes to restless legs, insomnia, headaches, and heart rhythm disturbances. Since stress, caffeine, and sugar all drain magnesium, many people live in a constant state of depletion. Restoring magnesium, either through diet or supplementation, helps regulate the balance of other electrolytes, particularly calcium and potassium. Together, these minerals coordinate smooth muscle and nerve function, ensuring the body runs efficiently. Electrolytes also play a central role in hydration. Many people assume dehydration is only about water loss, but without electrolytes, water cannot properly enter the cells. This is why drinking plain water in large amounts sometimes leads to bloating or frequent urination without truly quenching thirst. Electrolytes guide water into the cells, keeping tissues hydrated and functional. This becomes especially important in hot climates, during exercise, or for people on low-carb diets, where the body naturally excretes more fluid and minerals. A balanced electrolyte drink without added sugar can restore this balance quickly and provide a noticeable boost in performance and mental clarity. The nervous system relies heavily on electrolytes to send signals. Every nerve impulse is essentially an electrical charge created by the movement of sodium, potassium, and calcium across nerve cell membranes. If these electrolytes are not in balance, communication between the brain and body becomes disrupted. This shows up as muscle twitching, numbness, irregular heartbeat, or brain fog. For athletes, this can mean slower reaction times and reduced endurance, while for everyday individuals, it can mean poor focus, irritability, or constant fatigue. Maintaining electrolyte balance ensures that the nervous system fires smoothly and consistently. Another key aspect is how electrolytes affect acid-base balance in the body. The blood must remain within a very narrow pH range to keep enzymes and biochemical processes functioning correctly. Electrolytes like bicarbonate and phosphate buffer the blood against too much acidity or alkalinity. When electrolytes are imbalanced, the body struggles to maintain this delicate pH, leading to metabolic issues and increased stress on organs like the kidneys and lung. This highlights how electrolytes are not just about hydration or muscle function, but about keeping the entire internal environment stable. Dietary sources of electrolytes are abundant in natural whole foods. Potassium is high in spinach, kale, avocados, and squash. Sodium is best obtained from natural salts rather than processed foods. Magnesium is rich in nuts, seeds, dark leafy greens, and mineral-rich water. Calcium, another electrolyte, comes from leafy greens, seeds, and certain fish. The problem is that processed foods strip away these minerals, leaving behind an imbalanced ratio that favors excess sodium without enough potassium or magnesium. Over time, this imbalance contributes to hypertension, poor energy, and chronic illness. Because of modern diets, many people benefit from targeted electrolyte supplementation, especially those following low-carb or ketogenic diets, athletes, or people exposed to high heat. The best supplements are sugar-free electrolyte powders that provide potassium, sodium, and magnesium in the right proportions. They help restore energy, improve hydration, prevent muscle cramps, and keep the heart and nervous system stable.